Soccer is one of the most popular sports in Seattle. It's particularly widespread in families with young children and teens. But like any sports, soccer comes with risks, especially when it comes to foot and ankle injuries, and in particular, the toes. I often see young soccer players with injuries that could have been prevented with the right knowledge and preparation. Today I'm going to talk to you about the most common toe injuries and conditions that plague soccer players, how they're treated, and how to prevent them from occurring. But first, let me introduce myself. I'm Dr. Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. Also, if you find the information in this video helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. First is an injury called turf toe. While turf toe gets its name because soccer and other sports are often played on artificial turf, it can occur on any playing surface. Dancers, gymnasts, and basketball players are also at risk. That's because any sport that can cause the big toe to bend too far backward or hyperextend it can damage the ligaments and soft tissues around the first metatarsal phalangeal joint, MTP joint, in the big toe. That's the joint where your big toe meets the foot. The big toe is more likely to hyperextend in sports where sudden stops and quick direction changes occur during play. That's definitely the case with soccer. Turf toe can also develop gradually from repeated stress and overuse. Symptoms of turf toe include sharp pain at the base of the big toe with tenderness to touch, swelling and bruising around the joint, stiffness and limited motion, also making it very difficult to walk. Other risk factors for turf toe are wearing improper footwear, such as cleats that are too flexible, insufficient warm-ups, and improper gait. To diagnose it, I'll check for pain and stiffness and do an X-ray and an MRI if necessary to identify any damage to the underlying soft tissues. To treat turf toe, I recommend rest. If you continue to play on an injured toe, it'll be more difficult to treat. I may even have to put you in a walking boot. An acute injury will require icing, compression, and elevation of the foot to reduce the swelling. An anti-inflammatory can be necessary if your physician approves it. It can also help reduce pain and inflammation. I may also refer you for physical therapy to improve the range of motion and overall health of your foot and your posture. To prevent a recurrence of turf toe, it's vital that you purchase supportive shoes or cleats that are made for soccer. Keep in mind that cleats that are too flexible are more likely to lead to turf toe. More about this at the end of the video. Get any gait problems such as overpronation or rolling into the arch resolved by wearing custom orthotics provided by your podiatrist. Engage in proper warm-ups. I recommend dynamic warm-ups, such as those in the video above. Next are black or bruised toenails. This is something nearly every soccer player experiences at some point. This happens when blood pools under the nail, usually from direct trauma or repeated pressure. Common causes for this are getting your foot stepped on during play, cleats that are too tight or too short, causing your toe to repeatedly hit the front against the nail, toenails that are simply too long. Symptoms you may notice include black, red, dark purple, or blue discoloration under the nail, pain and tenderness, especially with compression to the nail, throbbing sensation, swelling around the nail. In some cases, the nail may start to come off. Most of the time, your nail will grow out over several weeks to months with no difficulty. However, if there is severe pain or significant pressure building up under the nail, it may be necessary to drain the blood to relieve any discomfort. This is usually a fairly quick and relatively painless procedure that can provide immediate relief. Finally, never try to rip off a loose or damaged nail. This can cause infection. Keep it attached with a bandage or Band-Aid, and we'll remove it at the office using sterile techniques and numbing that toe. Then there's prevention, where you can also do only so much to avoid other players stepping on your toes. You can take steps to avoid other common causes of black toenail. First, purchase cleats that fit and aren't too snug. Too often I see players that purchase cleats that are too tight with the belief that they will enhance their play and feel the ground better. But don't do it if you want to avoid black toenails. Wearing cleats that are too long for your feet will also cause problems, and your foot may move and piston in the shoe, hitting the front of the cleats. It's important to keep your nails clipped short appropriately for the same reason. Finally, two other conditions can occur for the exact same reasons. One's an ingrown toenail and the other is fungus toenails. I'll talk about them next. Ingrown toenails occur when the edge of the nail goes into the surrounding skin instead of over it. Leads to pain, redness, swelling, and sometimes infection. As I said, ingrown toenails can occur for the same reasons as black toenails in soccer, getting stepped on and wearing shoes that don't fit properly. Cutting toenails by rounding the edges like you do on a fingernail can definitely lead to trouble in an ingrown toenail in soccer players. Symptoms of an ingrown toenail are pain and tenderness along the nail edges, redness and swelling around the nail, drainage or pus, which is a sign of infection. Ingrown toenails can often be treated right in the office with a simple, minimally painful procedure. For chronic or severe cases, we use a technique that prevents that portion of the nail that's digging in from growing back, providing a permanent solution. Learn more about treatment and prevention of ingrown toenails by clicking on the link above. Toenail fungus is another big and ugly problem amongst soccer players. Unlike a bruised toenail fungus, also called onychomycosis, won't just go away on its own. In fact, without treatment, it typically gets worse and can spread to other nails and to other family members. Fungi love warm, dark, moist environments, exactly what you find inside those sweaty socks, cleats, and a damp locker room. And add that to repetitive nail trauma from cleats that are too tight, and you have the perfect recipe for toenail fungus. What to watch for: yellow, white, or brown discoloration, thickened nails, and distorted, misshapen nails. It's important to know that these can also be symptoms of trauma to the nail. An evaluation with your podiatrist will help you differentiate these two things. Our office specializes in treatment of fungus toenails. You can learn more about it by clicking on the link above. Now, in addition to buying the right shoes and keeping your toenails clipped, here's how to help prevent toenail fungus in soccer players. First, rotate between two sets of cleats so that each pair can fully dry out between uses. This usually takes at least 24 hours, or air out the cleats after every practice or game. Next, only use moisture-wicking synthetic socks, not cotton, which will hold moisture against the skin. Then, change socks after each game. Always wear shower shoes or flip-flops in a communal locker room and shower. And then, use antifungal powder. Shoes and as a preventive measure, or purchase a shoe zap, an electronic gadget to keep your shoes free of fungus. Finally, there's athlete's foot. It's caused by the same fungus that infects your toenails. It shows up as dry, itchy, sometimes burning, peeling skin with red dots, most commonly between the toes, but it can also affect the soles and sides of your feet, and it's highly contagious. You can use over-the-counter antifungal creams and sprays to treat milder cases at home, but you'll need to continue treatment for at least a week and sometimes up to 3 weeks until symptoms disappear to fully eliminate the fungus. Many families stop too soon and the infection comes right back. My motto: don't stop when the itch stops or you lose. If that infection doesn't clear up within 2 weeks of consistent home treatment, or it's spreading or becoming painful, prescriptive strength treatment may be needed. In addition to all the other preventive strategies I've listed, it's also important to dry the feet thoroughly after regular bathing, especially between the toes. Particularly the 4th and 5th toes don't dry out by just stepping on a towel. So you might wonder what to look for in soccer shoes or cleats, since footwear that is too short or long can cause many of these foot conditions and injuries. First, always measure your child's feet before buying new cleats. And I mean every single time. Kids' feet can grow as much as a half size in just a few months, especially during growth spurts. Don't assume you know their size by going from the shoes they were wearing last season. When trying on cleats, here's what you need to check. First is the length. There should be approximately 1 thumb's width, or about a ½ inch of space, between the end of the big toe and the front of the shoe. Next, have your child stand up while checking this, as feet expand under weight. Now, keep in mind, with too little or too much room, your child is more likely to have their toes hit the top of the shoe, causing injury and damage. Too narrow shoe causes trouble too, for compression and pain, and too wide shoes cause instability. Next is the heel fit. The heel should fit snugly without slipping. There should be no gap between the heel and the back of the shoe. Finally, test shoes for support. Hold the heel and the toe and try to bend the shoe. It should bend at the ball, where your child's foot naturally bends. If it bends in the middle or the arch area, it won't provide proper support. Hold the heel in one hand, the toe in the other, and now try to twist the shoe like wringing out a towel. A good cleat should resist twisting. Excessive floppiness can lead to injuries like turf toe. Just because a cleat looks flashy, carries a big brand name, or costs a lot of money doesn't mean it's good for your child's feet. Marketing doesn't equal quality. Stability, proper fit, and appropriate support matter far more than the looks or the price tag. In Seattle, many families have kids play outdoors, but they also play indoors. Here are a couple of rules of thumb depending upon the surface they're playing on. First, firm ground cleats. These are a great all-around cleat for the different types of outdoor surfaces. Next are turf cleats. These are meant for indoor soccer play only. These are more like tennis shoes and tend to have a wider toe box. Brands. The Soccer Post in Woodinville, just outside of Seattle, recommends Adidas, Puma, or New Balance for those with a tendency toward ingrown toenails and other toenail problems. These shoes have that wider toe box. While most kids will need to have their cleats replaced annually, biannually, or more frequently, it'll depend on their age. Kids' feet can grow very fast. If teens have stopped growing, it's still important to check their wear patterns. Ensure the cleats are intact, the uppers haven't worn out. If any of these have changed, it's still important to replace them, even if they still fit. In conclusion, soccer and other sports can place a lot of stress on the toes and toenails. Buying the right shoes and other hygienic practices are an essential part of preventing future toe and toenail problems.